A breakthrough in the race for treatment. A new data from Gilead shows that the antiviral drug remdesivir reduces the risk of death in severely ill COVID-19 patients. Here now is family emergency medicine physician and Fox News medical contributor, Dr. Janette Nesheiwat. Dr. Janette, always great to see you on the program.
Hey, Jackie, thanks.
I want to talk about this treatment that's coming out from Gilead, because not only does the stock move on this, but Wall Street gets very excited anytime there's news of a possible treatment in the pipe and that of a vaccine as well. It means that we can start getting back to business and life can, get back to normal. But the question is, Gilead's drug, how quickly could a patient that is severely ill actually start to receive this therapy?
That's a great question, especially because there's a shortage of this drug globally. But fortunately, our president actually secured 100% of remdesivir for the month of July and 90% of the supply for August and September. But this drug, it's used for those who are hospitalized, those who are ill, either on ventilators or, can you hear me okay? I'm sorry.
No, we have
Those who are on ventilators or requiring oxygen. And what this drug remdesivir does is it's used to help stop and block the virus from replicating, so stopping it from invading our bodies so that we don't become ill and don't become hospitalized. And the latest data suggests that 74% of patients who received this medication in IV form had recovery by day 14 versus 59% who did not receive this drug. They did not recover by day 14. They just received the standard of care. So it was shown to have a reduction in mortality, but further studies are required. We need more tests to determine, is this truly beneficial versus just what we call placebo effect, because it's also being used with other drugs. For example, Decadron, which is an anti-inflammatory, and rheumatoid arthritis medications as well. But fortunately, there's good outcomes so far from the limited data that we have. And also, it's not the only drug that's being tested and investigated. We have the dexamethasone, which is a steroid. We also have the convalescent plasma, also monoclonal antibodies like leronlimab, which are being investigated. So multiple drugs being tested, and this is certainly encouraging news as we move into the weekend.
I want to broaden out the conversation a little bit and look at some stats from the CDC. The first chart that I want to pull up shows the rate of COVID-19. As we know, I mean, you can see it's going pretty much, straight up there with respect to the spike in cases that we've seen. The administration will argue, well, we're testing more, that's why it's going up. Others would argue, that we're just seeing more transmission of this across the country. But the mortality rate, while everybody talks about how it's being decreased, I want to show you the figures here from the CDC. In week 26, 6.9%. In week 27, it has come down to 5.5%. Doctor, that is the 11th straight week that the mortality rate has come down. So when you look at the virus with respect to how it's spreading across the country, the administration has certainly said every life lost is valuable and matters. But the goal is to get that mortality rate to come down even further so that we can manage this, so that we don't destroy ourselves in the process with everything else that's happening with the economy. Your thoughts on how quickly we can do that with some of the drugs that we're watching?
Sure, and you're absolutely right. We're having epicenters now in the country, but it's only in certain states: California, Arizona, Texas. And you're absolutely right. The secondary effects of keeping the economy shut down can be even more detrimental for patients, for people in this country than the lockdown itself, because we have to also remember 600,000 people die every year from heart disease and cancers and not getting their vaccinations and not getting their preventative follow-ups with their doctors. So it's very important that we take a closer look at this mortality rate figure, because what that tells us is it's just less than 1%, but we still need to make sure that we don't continue to have these surges and outbreaks, because even though it's only in a few states right now, it's putting a huge burden on the hospitals, on the ICUs. Some of these states are reaching ICU hospital capacity, and it's stretching the doctors and the nurses thin. So having these medications sooner than later are detrimental. They're all still under study, under investigation. We can't rush them, but having multiple tools, the remdesivir, the Decadron, convalescent plasma, certain anti-inflammatory drugs, autoimmune drugs are also being investigated, in addition to the vaccine, which hopefully we may have by the end of this year. If
Yeah.
not by the end of this year, then early next year. For example, Novavax just received $1.6 billion by our government to produce 100 million doses of vaccine, hopefully by the end of this year. So all of this together hopefully will help us eradicate or at least control the spread of this virus. So we can't just look at the mortality rate. Really, the mortality rate should not be calculated in the midst of a pandemic rather than afterwards. But in the meantime, we need to really focus on preventative measures of covering your face, hand washing, physical distancing, cleaning and disinfecting, that sort of thing.
Dr. Nesheiwat, great to see you. Thank you so much for the
Thank you,
insight.
Jackie.
Really appreciate it.
My pleasure.